live on the Talk of the Quad Cities, 1130 AM and 99.9 FM. It's time for KQNA's Talk of the Town. Today's focus is on Chino Valley.
Good afternoon and welcome to the Talk of the Town on KQNA. I'm Arlene Allen, Director of the Chino Valley Area Chamber of Commerce, and today I've got some great guests. Dr. Andrew Lewis from Autumn Sage Dental. So don't go away. We'll be right back with my first guest. You're listening to the Talk of the Town on 1130 AM and 99.9 FM KQNA and online at KQNA.com. Welcome back to the Talk of the Town on KQNA, and with me now is Dr. Andrew Lewis, who is a dentist who we just did a ribbon cutting for in Chino Valley, new to the area, but a globetrotter. So welcome, Dr. Lewis.
Thank you. Thank you for having me on the show.
No, it's our pleasure, and you have such an interesting background. What brought you to Chino Valley?
Well, you are right. I'm kind of a gypsy myself. I'm from Southern California, and I went out to Oklahoma for a few years and practiced out there. And my wife said she didn't want to stay out in Oklahoma, so we wanted to come back to the West Coast.
This is close to the West Coast.
It is close to the West Coast.
There's no
ocean here. No ocean.
I'm a California girl too, so I'm just letting you know you're
sure,
minus ocean.
Sure, and so we moved to Arizona, decided on Arizona, and I was looking for practice to purchase, and I got in contact with some people who my attorney said, hey, there's this place up in Chino Valley, and I said, where in the world's Chino Valley?
I knew you somehow were going to say that, yeah.
Yeah, it's not where in the world's Chino Valley.
Isn't that in California?
Yeah, I know there's Chino and Chino, California, but there's Chino Valley, and so I looked it up, and I came to the area, and kind of the rest is history.
Well, awesome, and I understand you have a young child now.
I do. A little boy, 6 months old today, because today's the 14th, right?
It is, yeah.
So he was born in June, on June 14th.
Wow.
And he's 6 months old, so I got to get home. We're going to, take some pictures of him, I guess.
Well, yeah, because it's Christmas.
Right, it's Christmas,
so like
yeah.
Baby's first Christmas, and you kind of go crazy.
Sure.
So I know that you have you have a little different approach, I think, to your office and to your practice and to the mission that you have in the community. Why don't you tell us a little bit about that?
Sure. Well, I purchased the practice. I acquired the practice from a previous doctor. It was Country Road Dental Care, and we changed the name just because of some of the dynamics and that I needed a new sign on the building because the previous owner had such a small sign, so I got a different sign. But I didn't realize it at the time, but Chino Valley and the whole Quad City area has a large retirement community, so
yeah.
we've really tried to open our doors and with open arms really to help everyone in the community. So I know a lot of people are on fixed incomes, whether it be Social Security or they're suffering from dentistry that they've had in their mouth since they were maybe teenagers, things like
yeah.
that's deteriorating, and they really are looking for some place where they can find payment plans or anything like that. But we definitely want patients to feel welcome at our place.
So I know that we were talking a little bit about the adults and the seniors and the lower incomes. What have you been seeing most since you've been here? What surprised you the most about the new patients that you brought into the practice and those that were there?
I suppose one of the larger population base is a retirement and middle-aged patient base, where I'm used to seeing a lot of children and younger people. So a lot of people have that fixed income, or they have dentistry that's older, but they have missing teeth, and they have a lot of medications that they're currently on.
Yeah.
So that will afflict them also, or they have dry mouth, or they have gum recession, and they're wondering how come my teeth are sensitive, and they just, a lot of people just don't know. They say, well, it hasn't hurt for years, now all of a sudden it's hurting now, or my gums are puffy, or why is this happening now? It's because they're just getting older, and the medications that are sometimes influencing their oral environment.
And some of them are on a lot of meds that produce really strange interactions.
Mm-hmm. Mm-hmm. A pretty big common one is dry mouth. And so with dry mouth, and then the gums get shorter or smaller, and then you start seeing roots, and then you start saying, well, it's sensitive now, and this and that.
So you do a lot of education with your clients.
I try to talk to them and talk to them about their medication lists, and we will always take the initiative and talk to them with their personal physician or their nurse practitioner, whoever it might be, and see if we can get the healthcare team going in their favor.
So I know that you have all these special offers available to help people get the care they need, because a lot of times, I think particularly in the area that you serve right now, that people put off dental care because their fixed income is stretched about as far as it can go. So what can you do? What are you doing to help them?
Right. So we accept or in network with a lot of insurances, but for the retirement community, a lot of people have either lost their insurance, or they no longer have it, or that fixed income that you're talking about. And we have multiple payment options for people. So people don't need to put off their dentistry because we have multiple ways of getting them the treatment that they need, whether it be in-house payment plan or third-party payment plans. But we also have something right now. It's a 10% active military, or those who are veterans, because they're the larger retirement community. There's people who are in several wars or who are in.
This is one of the largest veterans communities I've ever come across. Mm-hmm. So most of the people at the chamber are veterans of something, some combat, going back to Vietnam and forward.
Mm-hmm.
So
and I honestly I love hearing their stories, whether they're good or bad, anything like that. And so we offer a 10% active military or veterans, and also for first responders, so police officers, paramedics, firefighters, things like that.
Terrific. So I'm looking at something that is kind of interesting, and that's your comprehensive exam for new patients. Am I looking at the right numbers? $19.95.
Right. So we want patients to feel like they can at least come in and see what might be going on. So we want to see, whatever they're suffering from. And so we say, hey, for $19.95, you can come in and get a full exam, and x-rays will give you a full diagnosis and treatment plan to say, what are our options? So that way they're not going around for several months, years, or decades saying, well, I always wanted to get that fixed, but now it's hurting, and I never knew what was going on. Now I have to have the tooth pulled. We don't want that.
Awesome. So they'll come in and you'll do x-rays included in that?
Mm-hmm.
Wow. And so you really see what's going on, and you can do that plan, and then maybe work with them over a period of time to fix those issues that maybe they put off for so long.
Exactly.
I'm going to have to send one of my volunteers over to you. So what is an unscheduled appointment?
So an unscheduled appointment is really if they'll call up saying, I need to get in right now. That tooth is killing me. I just have to see somebody. No one will let me in. We're always going to let that person come in.
That's awesome.
At least just see what's going on, see if we can do something, because I don't want them, especially on a Friday, I don't want them to say like, holy cow, I got to wait until Monday now to get in to see a dentist.
This tooth is going to hurt me now. It didn't hurt before, but now, at least not bad, but now it's hurting really bad, so I need to find a dentist.
It always hurts on a Friday at 4:30 p.m. That's always when a tooth hurts.
It's a rule, isn't it? I know. That's when all the emergencies happen. And so I know that you've had just a huge background. How did you get what did you do after Southern California? You've been all over the world.
Right. So when I was younger, I somehow I got interested in languages, and so I was in high school and got interested in Spanish, German, French, all these different things. And when I was an undergraduate, when I was in college, I wanted to do something. I didn't want to just major in the chemistry or mathematics or whatever most people do. And so I decided I wanted to major in Spanish. And so I went down to Argentina and went to school down there for about 6 months, and then I went to Chile. And before I did that, I took this surfing trip all the way down through Central America down to South America.
California boy.
Yeah, I suppose so. Yeah. And then after college, I didn't want to go right to dental school, so I decided to do something else. I went down and taught English for a year in Ecuador.
Fascinating. Wow.
My dad said, "What the heck are you doing? You need to go down and get a job." And I said, "Well, I am getting a job. I'm just teaching
English.
teaching English."
That
in
is a
South
job. I
America.
mean, you know.
It's a job, right? So I lived with a family, and they're still my friends today. I got a lot of friends in South America.
That's terrific. And so you bring with you a lot of language abilities, and speaking Spanish is something I wish I did. Speaking French does not come in too handy in Chino Valley. So, yeah.
I'm trying to learn French slowly, but there's no one really to speak French with. And
Call me. We'll chat.
There we go.
It's lonely being the only French speaker in Dewey and Chino.
Okay.
Yeah. So in here it comes in really handy for reading menus. That's about it. Yeah. So yeah. So but in Spanish is great. And so, what's the next plan? What are you going to do? What's the plan for the next 5-10 years for you?
Well, I desperately want to get involved into the community of Chino. I really like everybody in the Chino area. I like the small town. I'm from a small town in Northern California, originally, and I'm going out, meeting people, getting involved, and just people ask me all the time, "Are you going to stay in Chino? Are you going to stay in Chino?" And I say, "Well, yeah, as long as you don't run me out of town, I should be here."
People always ask us that. They're always wary when we come to town. People always say, "Are you going to stay at the Chamber? You don't live here." And I go, "No, I love it here." And so it's a great place to be. There's great diversity in population. There's a lot of things to do and a lot of ways to get involved. Mm-hmm. So particularly as your child grows up a little bit and starts to be more mobile on their own. So I think you're going to have a great time, and it's good to have you there. And I think we haven't had the understanding in the community is that there haven't been a lot of medical professionals who've come and who've stayed. Mm-hmm. So we look forward to you building your career and your practice in Chino Valley and getting engaged with the community. I think that's going to be awesome. And so what are your plans for the holidays?
Well, my wife is going to have to be working, and I'm going to most likely just be babysitting, so I'll be taking pictures and maybe posting stuff on social media.
I was going to say, no, I'll be up on Facebook,
sure,
and she'll be able to
we do have a social media account on Facebook and Twitter and some of the other ones, so some patients and people will follow us and see us on their updates to the office and things like that.
That's awesome. Dr. Lewis, how can they reach you? How do they reach your office?
Well, they can reach us by going online on www.autumnsagedental.com, and they can call us at 928-237-1305, and they can also find us on Facebook and some of the social media outlets.
Pretty much it's going to be hard to avoid seeing you.
Possibly.
Dr. Lewis, thank you so much for joining us today, and I know that you're going to be coming back for years to come, and we're going to hear all the stories that you have to tell us. Thank you for joining us, and thank you for listening. Don't go away. You're listening to the Talk of the Town on 11:30 a.m. and 99.9 FM KQNA and online at kqna.com.